Just when millions of Americans thought there was no relief in sight with the rising cost of living, something extraordinary is unfolding this October 2025. If you're receiving Social Security, SSI, or SSDI benefits, you're about to see some of the most dramatic changes in recent memory. This isn't just another small update, this is being called one of the biggest payment adjustments in decades, and the ripple effects could reshape the financial future for millions across the country. But here's where it gets even more fascinating. These changes go far beyond numbers on a check. What's happening right now is the result of historic economic shifts, intense political battles, and a reimagined approach to supporting seniors and vulnerable Americans. Some of these new programs weren't even being discussed a few months ago, yet here we are in October, and they're now a reality. Before we dive into the details, make sure you subscribe to Wealth Wave and turn on notifications, so you never miss critical updates about your benefits. With how fast these changes are happening, staying informed could be the difference between missing out and maximizing your monthly support. Starting October 2025, Social Security checks are now reflecting the full impact of the 2024 COLA adjustment, but this is no ordinary cost of living increase. Because of persistent inflation and unique economic conditions, the COLA for this cycle is one of the largest we've seen in years. And that's just the start. Remember those heated debates in Congress last year about reforming Social Security? They finally resulted in the launch of the Emergency Supplemental Payment Program. This means beneficiaries with the lowest incomes are now getting extra payments on top of their usual benefits. For the average Social Security recipient, this combination of COLA plus supplemental support adds up to hundreds of extra dollars each month compared to early 2024. For many seniors, this boost could mean catching up on bills, affording groceries, or covering rising healthcare costs. There's one important detail most headlines are skipping: these increases are being rolled out in phases. That means not everyone will see the full amount immediately. Payment dates and amounts could look slightly different than what you're used to, but this is part of the new system being put in place. At the same time, the Social Security Administration is introducing a new verification system to confirm eligibility for supplemental payments. Many of you may have already received letters about this. Don't worry, it's simpler than it sounds. The process has been streamlined, but there are important deadlines you'll need to meet to ensure your payments aren't delayed. For SSI recipients, there's even bigger news. For decades, the resource limits that determined how much you could save before losing benefits never changed. Now, for the first time, those limits are being adjusted for inflation. This means you can finally save more money without the fear of losing your benefits, something advocates have been pushing for years. If you're on SSDI, there's also a positive shift. The trial work period thresholds have been raised, making it easier for beneficiaries to test their ability to return to work without immediately losing support. This is a major step toward giving people more flexibility and reducing the financial risks of trying to re-enter the workforce. One of the biggest sources of confusion right now is the modified payment schedule. To handle these supplemental payments, the SSA is rolling out a new distribution system. If your check comes on a slightly different day than usual, don't panic, it's part of the transition. Also, new reporting requirements are being put in place to reduce benefit overpayments, which became a big problem in 2024. The good news is the online reporting system has been improved, making it much easier to stay compliant. But staying on top of this is crucial if you want to avoid interruptions. These Social Security changes don't stand alone, they also affect Medicare. With higher monthly benefits, your income might change how you qualify for certain programs. The good news is that the Medicare savings programs have expanded, meaning more people can qualify for help with premiums and out-of-pocket costs. That could save beneficiaries hundreds more each year. On top of federal changes, some states are increasing their own supplemental payments. Depending on where you live, you could see an even bigger boost than the national average. Another critical update: the SSA has streamlined the appeals process. If you think you're not receiving the correct amount, you now have faster options to request a review. This is especially important for SSDI applicants who have historically faced long delays. And for caregivers, here's a huge development: the Caregiver Support Payment Program, tested in select states in 2024, is being rolled out nationwide. If you're caring for a disabled family member, this could mean extra monthly support just for you. Here's something many people overlook: these benefit increases aren't just helping individuals. They're expected to inject billions of dollars into local economies. When seniors and disability beneficiaries have more money to spend, local businesses thrive, creating a ripple effect that benefits entire communities. These changes are complex, and the details vary based on your situation. Some increases are retroactive, meaning you could be owed back pay. But qualifying depends on specific rules, so it's worth checking your status. Also, the SSA has launched a new online portal to help manage these enhanced benefits. It's more user-friendly than older systems but comes with stricter security. Learning how to use it will be key to keeping your benefits safe and accessible. This October marks one of the biggest shifts ever in Social Security, SSI, and SSDI. Between COLA increases, supplemental programs, new reporting systems, and caregiver support, beneficiaries are seeing changes that could redefine financial stability for millions. At WealthWave, we'll continue to break these updates down for you, because the better you understand your benefits, the more you can maximize them. So let me know in the comments, how are these changes affecting you? Are you already seeing higher checks, or are you waiting for your phased increase? Your feedback helps us create content that answers the questions you care about most.